Hello, friends. How are you doing today? I hope you're fine. So, I am back. I had taken a short break, but I am back and we are ready to kickstart our series. The last time I came on here, I did say we're going to have a series where we're going to be talking about how to start the home care. It's been a time of rest for me and reflecting on things. And I know in December we had a very, big challenge, but now we're back. We're back, my friends. And we are back with those people who are serious and want to build their home care. So if you're serious and want to build your home care, yes, this is the space for you. Hi, my name is Betty, and I am a home carepreneur, and I am also a provider. And the tips I'm going to give you for starting your own home care, especially in Texas, are things that I have done personally. Okay, they're things that I have done. They're things that I have tested and tried. Okay, so I think if you listen to some videos back, you will learn about me a little bit, and you will also learn that I started off in the healthcare field as a CNA. A CNA is a certified nursing assistant, and I enjoyed my work. I really loved helping people. But there's one thing that I found that was common amongst the people when I was, like after you see the clients. So when you're working in this industry, you know that if especially if you've been in the industry for a long time and you've worked in home health, right? Home health is where they have the nursing, they have the PTOT, and then they have the CNA. So if you've worked in the industry for long, you know that home care home health, sorry, recertification happens after every 60 days, because they have to show why they need more visits for them to get approval, right? So they have to show why they need visits for CNA, PT, OT, ST if needed, all those things, and nursing, right? So you find that there are some uh, things that are dropped off when there's a recertification. One, the whole services might be dropped off because maybe the patient or the client has met the needs that were required for that treatment time. And or you find like some things like maybe OT, PT might start dropping off, and then CNA services may drop off too. Okay, so that's what happens. So if you haven't been in the home health space, you might not really understand that. But if you've been in the home health space, you have seen this before, that, patients they finish their time and then they move on. Okay, so while I was working as a CNA, I noticed that that was happening a lot. And, that's the way the system works, right? So there's nothing like, you know, extraordinary about it. That's how the system works. You have to do a recertification and show the need for continuation of service. But some people did not qualify for continuation of service. So when I was working and then I come and tell them, oh, Miss Smith, today is my last visit with you. You know, sometimes you find that people get emotional because that CNA visit helps most of them. That CNA visit determines if you're going to take a shower, because sometimes those people, they're not able to take a shower. Maybe they're still feeling sick, but according to the way the system is structured, it might look like now you've exhausted your CNA visits. Now you should be able to do things on your own. And so I found myself in a situation where some patients would ask me, hey, Betty, could you please come and help me shower? I will pay you, So they would tell me, come and help me shower. I just need to shower. That's all I need. I need to shower twice a week. And I was like, you need to shower what? Twice a week? You know, I mean, that was amazing that twice a week meant something to someone. I shower every day. So someone is so sad because they can't shower twice a week. That was like very, very, I mean, for me, it was very disturbing, okay? Because I would expect that, you're a grown up. shower every day at least, even if it's not twice, at least you have a shower every day, even if you don't have to shower twice. So I would agree, like, because I mean, out of my heart, hey, you know, you need a shower. But as I grew in the home health field, I learned about home care, and home care being the extension of services, like ADLs, people are not able to do things by themselves. And that's when my interest was triggered, like to know what is home care, because home care is different. So let me tell you the difference. And this is where I want you to decide your lane. Decide your lane, what lane you want to take. And you can start with one and progress to another one. So decide your lane, because when you decide if you're going to do home health or home care, that determines the type of certificate, the type of licensing that you will need to be applying for. Okay. So in this case, we are talking about home health and home care. And for those who are joining me right now, we are talking about how to start a home care business. And specifically, we are talking about Texas. Okay. So this is home health. Home health, I have, this is how to make it easy for someone who does not understand home health, especially in the state of Texas. Home health, you go and see the client in their home, okay, or the place of residence. Home care has nurses, PT, OT, ST. Sometimes some people might need ST when they're going home. Some people, on some occasions, I have seen once in a while, maybe a dietitian being recommended. Oh, social worker is part of that. Okay. So it's like a whole big team that works together, home health. So that means, get your treatments at home. Okay. So whatever the doctor has ordered, the continuation of care continues at home, and they give the report to the doctor. Okay. So that is briefly home health. Okay. There's so much into home health. I'm just doing briefly. There's so much into home health. So what I'm just telling you is just, like I'm just passing through. There's so much into it. So the reason we are here is to talk about home care. So home care, you still go to see the client in their home, okay? In their home. And I know so many people, they mistake home care for group home, okay? Group home is where you have a house and you put people there and you take care of them in one place. But in home care, you go to their home or the place they call residence. It could be a senior living facility. It could be their home, it could be their daughter or their son's home, they're calling it their home at that time. So those are the places that you can call home. So with the home care services is where we provide non-medical services. When I say non-medical, that means we are not administering any wound care. We are not administering any medications, okay? Those, for things like medications, we're doing medication reminders, okay? There is no treatment that we are offering. What we are offering in home care is lifestyle maintenance for the person at home. So that's where you find we are giving them personal care services, okay? Personal care services. We are offering them like meal prep. Some people are not able to prepare meals for themselves. Companion care, maybe the family is tired, so you're able to offer respite care, and there's so many other services that we're going to go along with this series. Now, if you follow me through this series, you will be able to see that, home care is very, very broad. And there's so many things you can do. Now, remember I said we are deciding what we are getting ourselves into. And in this case, we are getting ourselves into home care, which is non-medical, okay? Home care too is vast. You can provide home care for different demographics of people. So you also have to think about that. Am I providing home care for veterans only? Am I providing home care for seniors only? Am I providing care for adults? So it's not just seniors, but anybody that is an adult that needs care at home. Am I providing care for special needs? Am I providing pediatric home care? Which is another story altogether. Pediatric home care is it's another thing altogether, because if that's the route you decide to take, you have to be very, very careful too with everything that you do. I'm not saying that, I'm not minimizing for the senior care, but pediatric, for home care for pediatric normally comes a lot with what do we call it? It normally comes a lot with a lot of medical stuff too, okay? And so that is where, let me see here. I'm just seeing, let me see. Yeah, so I was checking because, I have you guys here on YouTube, and then I have, you know, um, I'm recording for my team. What not my team, my community too. So that's I have to like make sure that everybody is on. And here it was telling me refreshing. I don't know what it was refreshing. So I have to record as we go. Okay. So I have told you home care versus home health. So you have to like really, really give me a minute. Yes. Yeah, home care versus yes, yes. Yes, yes. Oh, yeah. So someone says here I should mention that you can move from home health to home care and vice versa. Okay. So that's another story we are going to talk about, but they are mentioning that because they're in my community, so they see a lot and they talk a lot about a few things whenever we meet on our monthly meetings. So that's another thing. If you want to join my community and be part of my community and also have a way of, communicating with me directly, because sometimes here on YouTube, I really enjoy coming here and talking to you, but also, you might not be able to ask me questions the way you are looking at things. And also I might not see your comment or something. So don't feel offended. Just join the community. It's a free community. Come and hang out with us. Come and hang out with me and ask me questions as we go along. So, and then, okay, I've talked about home care and home care, deciding what you want to start. Okay. Deciding what you want to start. Then once you have decided what you want to start for your home care business, then now you move on to the next step, where you are going to the Texas Health and Human Services website to see what is needed for you to be able to make the application. Now, in this series, I will go along with you. We are going to go along together, and I will be doing some presentations on the website and how to do the things. Some of the things I will do, but some of the things you will need to be in the community for you to see how they are done. Okay, and then the other thing you have to do is research. Do a research, like where you are located, right? It doesn't matter whether you're in Texas, whether you're in Idaho, it doesn't matter where you are. Do a research of the home cares that are in your area. How many home cares are there approximately? You might not be able to get the exact number unless the statistics are, current, right? Because if something was done in 2022, there's a very big difference 4 years later. So check where you are. How many agencies are there? What do they provide mostly? And also find out, you can also find out, sometimes you might call, like if someone calls our agency and they ask us how much do we charge per hour, we cannot tell them the exact amount we charge, but we can give them a range, and the reason why is everybody's services are different. We might have an individualized care plan, but our services are different. And those are the things that you get to learn in the program, in the Home Care Startup program. So those are the things you get to learn when you're there. But for what I can say is, when you're doing your research, it's okay to call and ask. You don't have to say you're starting a home care agency, but you can call and ask what's the approximate fee that you charge per hour. Okay, so do your research, do your due diligence. Know if you really want to start the business, because once you start this business, you're dealing with people's lives, you're dealing with people's lives. So I don't know how else to put it, but if I am dealing with somebody's life, I have to be very, very careful about what I am doing to make things better for them. Okay, now then, so on this first episode, I wanted to just introduce that we are starting the challenge. It's going to be a good ride for the challenge. So it's going to be every week. I'm going to be coming on here and dropping something about home care. So if I repeat something, is because I don't want you to miss out on it. Okay. And remember, I don't want you to miss out on that. Okay. If I repeat something, pick it up, and there must be a reason why I'm repeating it. Okay. Now, again, just a recap. Decide the lane that you want to take. Okay. Decide the lane that you want to take. That will determine the license that you are going to be applying for. Secondly, do a research. Do a research of the services most people ask for in your area. Go to the websites of the home cares that are near you. See what they provide, and see see how they do things. You're just looking, you're just doing a research. You're not trying to copy anyone. Again, when it comes to home care, because we offer the same services in most of our agencies, you're just going to do a research to learn about what you can give, but you have to bring your own flavor to the kind of home care you have. I can have services same as another agency, but the way we approach it is different. Although we are providing the same service, the way we approach it is different. So bring your heart to it. Yeah. From today, if you are serious about starting your home care, from today, write down things. When something comes in your head, write it down. If you can go to a dollar store, or a dollar store, go to a dollar store, get a booklet, start writing down your ideas as we go along. Because when I come here and talk, you might grab an idea, just write it down. That will be something that will help you in the coming future. Okay, so I look forward to seeing you again next week. Next week, we're going to just break it down nicely, and I'm going to do like presentations for you, so you can be able to see how you can move on and start your home care. I am so blessed to be here. And every time I say thank you for those who have decided to follow me. You've made your choice to follow me. I hope that you're going to learn something from here. If you do need something to service to do with home care and I have not mentioned it, please let me know. Drop a chat or join the community. The community link is going to be on here. Just join the community, and in the community you can message me directly and I'll be able to answer you. We do have a lot of things that work for home cares, because we do have things like templates. We do have things like guides. We do have things like kits that you can use to start up, and all I ask people is start where you are. Okay. Don't try and compete with people who have made 6 figures or 7 figures in their business and you haven't made a dime. One step at a time. And the step for this week is deciding what type of care you want to provide. Deciding. That is the very beginning of winning. You decide. And once you decide, then we can